Good evening, guys. I have discussion D for you. Now, tonight we're discussing how a long federal shutdown disrupts health care. The headline: Democrats' long federal government shutdown hurts health care, signals a broader concern voiced by Democratic lawmakers and health advocates that prolonged interruptions in federal operations have far-reaching consequences for the health and well-being of millions of Americans. Drawing from the surrounding page content, the argument is not just political, it's rooted in tangible disruptions. 2. Systems that underpin public health, clinical care, and social support. Systematic disruptions to health infrastructure. Federal funding freezes, halt the flow of money to agencies like HHS, CMS, and CDC, which oversee everything from Medicaid reimbursement to disease surveillance. Without appropriations, these agencies cannot renew contracts, issue grants, or maintain operations. Planning paralysis sets in when departments cannot forecast budgets or commit to long-term initiatives. This affects everything from rural health outreach to innovation pilots like hospital at home programs, regulatory delays, updates to health policy, reimbursement rules, and safety standards, especially critical for evolving areas like telehealth, behavioral health, integration, and opioid response. Vulnerable populations hit first. End of life care and hospice programs face imminent strain. Advocacy groups cite in the page contexts have filed formal complaints warning that funding gaps jeopardize services for terminally ill patients. Low-income families and seniors rely on SNAP, WIC, and housing-linked health supports may experience brief delays or suspensions, threatening nutrition and medication adherence. Rural and tribal health systems often depend on federal grants. and contacts are disproportionately affected with fewer local resources to fill the gap. Economic fallout for patients and providers. Insurance instability emerges when subsidy programs like ACA premium supports are paused or threatened. This can lead to coverage lapses or higher out of pocket costs. Provider payment delays, especially for those serving Medicaid or Medicare. Populations. Strain cash flow, reduce staffing, and limit appointment availability. Local governments and hospitals must absorb cost temporarily, diverting funds from other critical services or emergency reserves. Public health and innovation at risk. CDC and NIH program suspensions mean fewer resources for outbreak monitoring, vaccine distribution, and research. Community this weekend's national preparedness. Emerging care models such as remote monitoring, community paramedicine, and integrated behavioral health depend on federal guidance and reimbursement pathways. Shutdowns stall their rollout and evaluation. Workforce morale and retention suffer when federal employees face furloughs and contractors lose income, leading to talent drain in critical health sectors. Democratic lawmakers' position. Based on the page content, Democrats are urging swift action to end the shutdown and restore stable funding. Their argument emphasizes the interconnectedness of federal operations and health outcomes, the need to protect safety net programs that serve millions, the importance of community in public health, innovation, and care delivery. Real world consequences for patients, providers, and communities, especially those already facing structural inequities. Bottom line, if a long federal shutdown is not just a bureaucratic hiccup, it's a cascading disruption that touches every layer of the healthcare ecosystem, from delayed benefits and stalled innovation, 2, weakened public health defenses, and strained local systems. The impact is profound. Democratic lawmakers and health advocates argue that until funding is restored, the health of millions remains at risk, especially those who depend most on federal support to survive and thrive. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks. Remember what I said earlier about leaving me comments about things that we discuss. If you have anything to add to the show or question about the show that I've done, leave it in the chat below for me, please. And we'll see what we can do about getting you an answer or making it into another show. So, line is open for chat answers to this show. So here we go. I will sit on here for a couple more minutes to see if anybody has anything to add to the show. So I will sit here for a couple minutes, folks, and we will see what comes.